Inside this warehouse at a DMARC food pantry, the scale of the task at hand is apparent.
Our food pantry network has been on a precipitous rise, honestly, for the last couple years, but this past year has really been incredible. We provided assistance to over 65,000 unique individuals. If you look at it as about 1 in 4 Des Moines residents came to a DMARC pantry this past year. We're not talking about a small problem. We're really in a crisis sort of situation at this point.
The same is true at St. Vincent de Paul centers, where food, clothing, hygiene products, prisoner reentry services, and workforce training are more in demand than ever.
The DMARC network has shown that over 2,000 new families that's never accessed the food pantry before are coming every month. Those are families that have never had to ask for help before. But inflation and groceries and gas and rent and utilities and all those costs are different now, and wages simply can't keep up.
That increase isn't limited to just food and supplies. Other services, including mental and physical health, who are served by these many organizations, are often handicapped by accessibility.
If they have to go to multiple agencies and multiple locations, then they simply can't reach those services in a timely fashion to get them those services and get them those solutions to keep them coming back and keep them engaged.
A possible solution? Multi-agency collaborations to address multiple barriers to success in one location with one case manager and one key contact. A one-stop shop, so to speak, for community resources and services. This collaboration would address many barriers to success in one location by sharing space, resources, structure, and data, enabling providers to meet clients' needs where they're at.
The multi-agency collaboration mitigates those barriers to success for those people that are most in need and provides all of those resources through multiple access points across Polk County, including virtual options.
The beauty of the multi-agency center model is that it truly gives us an ability to meet people where they're at. And that is what's so critical. We have to make it easy. And this thinking and this model allows us to do this.
This project is a 10-year commitment focused on getting employment specialists or community navigators into the busiest food pantries in central Iowa, followed by the opening of one new multi-agency collaboration center to provide services ranging from food, clothing, hygiene products, workforce training, prisoner reentry services, rent and utility assistance, transportation assistance, and possibly even mental health and substance abuse services. But in order to make such a model possible, it will require partnership, community buy-in, innovation, and reassessing how services are provided. A new model to meet people where they're at and offer in-person and virtual services. It won't be easy, but nothing substantial ever is.
Something like this is not easy to do. We're working with a number of different partners who are interested in being a part of this. We need help from the philanthropy community. This is not a small undertaking. We think over time it'll be a much more efficient and a much more effective way to meet people's needs, but it is going to take some upfront funding and we're going to need that support.
Community service organizations agree. The current Band-Aid approach to providing services the same way is no longer sustainable based on today's needs. To truly make a lasting change and lift those in need out of poverty, a multi-agency collaboration approach is what Polk County needs to serve those tomorrow.
People who need these kinds of changes in their lives to not only change where they are today, but change their futures and the futures of the generations that we need to impact in order for Central Iowa to thrive.